Hello everyone, myself Yash Shivkumar Purohit. I am presenting a topic about influence of COVID-19 on circadian rhythm and by the guidance of our scientific supervisor, Doctor of Medicine Mikuляк and candidate and of the biological sciences. At the behalf of the Department of Human Physiology at the Penza State University Medical Institute at the Penza. So starting my topic, let's talk about the purpose and significance of my topic. It is to study the impact of COVID-19 on the circadian rhythm of a second year students. The significance is to date, experts notes the manifestation of sleep disorders associated with the COVID-19 in every fourth person. The pathological processes often leads to a mismatch of rhythms. One of the most important is disruption of a sleep-wake cycle. And then moving forward, let's talk about the circadian rhythm. Circadian rhythm. What does circadian rhythm means? Circa, which is about, and dian, it is day. It is referred to the body rhythms that have a roughly 24-hour cycles. So the circadian rhythm, let's talk about the normal circadian rhythm. It is a day and night cycle, the normal person cycle, which we can, in a day a person wake up and work and the night he sleeps. So the timing of the circadian rhythm is depend upon the melatonin. Melatonin, it is an hormone of a darkness which helps you to fall asleep and stay asleep. Yes, and then cortisol. It is a stress hormone, helps you wake and start the day. Now let's talk about the generalized form. What is a sleep? Sleep is a dynamic and actively produced brain state with accompanying changes to a physiology. So sleep is not a static or a passive. We do not turn off during sleep. Some brain regions are more active during sleep than awake, although some are lower. It depends. No. So now talking about our study research on the methods. So in the study research, we prepared 40 questionnaires of a foreign students of a second year of medical institute were analyzed. One of these 20 students had COVID-19 in the 2023 to the 2022 academic year, and 20 students who did not have a COVID-19 in this academic year. Such indicators as a chronotype, duration, and the quality of the sleep, it affects the presence of the sleep disorders as well as daytime sleepiness were evaluated. So at this time, the sleep questionnaires for the adult John Radcliffe Hospital, Headley, Way, Oxford, and the Horn Oresburg chronotype test, which is a morningness, eveningness questionnaire. In short, it is MEQ, were used. In that, we saw the results were seen. According to the result of the test for the chronotype, most of the subjects belong to the intermediate type. In the second place were the moderate evening and the moderate morning times. Least of all were definite morning types. It indicates the main importance. Let's understand that importance. That most of the students melatonin onset occurs at about 10 p.m. It is at the night. So let's clear the concept morningness and eveningness. Scores ranges from 16 to 18 on above average. So the score of 41 and below indicate evening types. And the score of 59 and above indicates morning types. And the score between 42 till 58, it indicates the intermediate types. So this is shown in the following chart. You can study this below. Now let's talk about a severe condition. Let's talk about COVID-19. It is a threat to the circadian cycle. A circadian rhythm is present in the heart rate of the COVID-19 patient admitted to the general ward. In this time, we found no consistent changes in circadian rhythm and amplitude accompanying patient deterioration. And then we see the certain effects. Let's talk about a cycle which is known as the hemostasis between sleep circadian and immunity. It shows a let friends. It shows a bidirectional relationship, such that in this we can see the changes during COVID-19. Also, the changes in our daily routine, such as getting up at certain time, eating, showing up late for a work, exercising, and engaging in social and leisure activities at relatively fixed times are important timekeepers for keeping our sleep-wake cycles in sync with the day and the night. These were the changes seen during COVID-19, and also we can see some another symptoms because of the COVID-19, which changes the circadian rhythm. We face the problems of the blood pressure, the ANS dysfunction, the inflammation, metabolic function, dyslipidemia, physical activity, and sedentary behavior. Also, the diet due to obesity and some psychological disorders such as stress, anxiety, depression. In that, we concluded that several studies show that the severe impact of the COVID-19 on the sleep quality, chronic fatigue, and it causes anxiety and depressive symptoms in caregivers, healthcare staff, and the patient affected by the chronic disease. And some research also show that it affects the family of that patient and the surrounding environment. In the initial studies, based on the clinical features, the physiopathology of an acute respiratory disorder induced by the either highly homogeneous coronaviruses or other pathogens showed that excessive inflammation, oxidation, and an exaggerated immune response very likely contribute to the COVID-19 pathology. This leads to a cytokine storm and subsequent progression to an acute respiratory distress syndrome. In short, it is known as ARDS, and it is often fatal. The end of my presentation. Thank you for your attention. Thank you so much.